Okay, we're going to start our lesson on therapy. So the first type of therapy that we're going to talk about is the psychotherapies. So each of the major perspectives has a different way that they conduct therapy with their patients. The first is psychoanalysis driven by Freud. Again, main focus is going to be on the unconscious, free association, childhood memories, dreams, transferences. What they tend to do, the psychotherapist will do with its patients, is they might pretend that they are the person. Maybe you have an issue with your parent, so the psychotherapist might pretend that they're your parent. That would be called transference, where you can say what you need to say and get it all out. They may try to focus on dreams that you've had and what those dreams might mean, and childhood memories. Humanistic is going to focus again on like living up to your fullest potential, your self-fulfillment. They're going to focus more on what we call insight therapies. So they try to focus on the awareness of why you might have done something or why you might feel a certain way. They're going to focus on what we call client-centered or active listening. So trying to, again, get to understanding of why a client might feel a certain way. And again, their focus is on unconditional positive regard. So the therapist has unconditional positive regard for their client and the fact of, trying just to create a positive environment for them. And behaviorism is all about learning. So trying to condition somebody's behaviors through rewards and punishments. We do this with exposure therapies and systematic desensitization, virtual reality, aversive conditioning, and operant conditioning. So you all have been through some aspect of behaviorism conditioning at some point in your life, especially when you're a little kid. If you had to earn stars or earn marbles in a jar for a pizza party, that's a type of token economy behavior modification. We can also use this if somebody has a fear of something. They slowly get them used to it by exposing them little by little. And virtual reality is just exactly what you think it is. You're going through a virtual reality trying to live out something that may be causing problems. Psychotherapies continue to additional therapies. Cognitive therapy, this is again is the way that you process information, the way you think about things. We typically practice what we call cognitive behavioral therapy. So they focus on the way you think, but also the way you behave. So they might ask you, give you a scenario and ask you why you think that or what you think about it. Another type of psychotherapy would be group and family therapy. So things like AA would be an example of group therapy. How effective is therapy? Well, they did a meta-analysis, which means that they combined a variety of different studies and took a look at all those conclusions to get a better idea of whether or not psychotherapy actually works. And maybe not for everybody, but overall, yeah, it really does. Typically, those in therapy are more likely to improve than those who don't go through therapy. So overall, it can be pretty effective. They also find that people who spend money on therapy are less likely to spend money on medical treatments, which makes a lot of sense. A lot of medical problems can be caused by stress, and if you are working with somebody and talking through some of the problems that you're facing, that can be a great stress reliever, and therefore people don't spend as much money on medical treatments. What we find is that behavioral therapies specifically are great for bedwetting, people who might have phobias, compulsions, and marital problems. We find that cognitive therapy can be good for depression and reducing suicide. But we do know that people that have less focused psychological disorders, like overall anxiety that goes beyond just like generalized anxiety disorder, people that might suffer from like a PTSD or phobias, depression, severe depression, and schizophrenia tend to typically need more than just therapy. We also use psychoactive drugs. One of two different therapies to talk about is the eye movement desensitization and reprocessing. This is kind of interesting. Whereas a trained psychologist would use rapid eye movement when the patient is recalling a trauma. So they get the eyes to move rapidly, usually with a light, when they're recalling trauma. They do find this can be effective. They find it is effective, though, for people typically who suffer from one traumatic event, not somebody who might have like PTSD from fighting in war, where there's multiple traumatic events. And also light exposure therapy for people who suffer from seasonal depression disorder or seasonal affective disorder. So depression in the winter, pretty common, and they find that light exposure can be extremely helpful for those people. And the drug therapies. Dun, dun, dun. This is a bad graphic, I know that, but I feel like it still did a good job of showing you what an SSRI is, and I'm going to come to that in a minute. The first type of drugs is the antipsychotic drugs. These are people that suffer from some type of psychosis or positive schizophrenic symptoms. That means you're adding symptoms, so things like hallucinations and delusions. One of the major problems with antipsychotic drugs, though, is it has a lot of side effects. Tardive dyskinesia is one of them, and that can cause paralysis in the facial muscles or twitchiness in the facial muscles. A second type of drug is anti-anxiety, and we see a depression in the central nervous system. One thing to note is if you're on anti-anxiety drugs, you should not drink alcohol, because alcohol can also depress the central nervous system. You don't want your central nervous system too depressed, or it will not function properly. Something else to know about anti-anxiety is that it can cause physiological dependence. So people think that they need it. Once they stop taking them, their symptoms tend to get worse because it actually increases anxiety. So it's something to make sure that if you do want to decrease or stop taking your anti-anxiety medications, that's definitely something you can do. But you should definitely talk with a doctor about that so that they can slowly reduce your dosages, which would help prevent the physiological dependence. Antidepressants help with anxiety and depression because it increases the norepinephrine or serotonin in the brain. And the way that it does that is by an SSRI, which we call selective serotonin reuptake inhibitors, which means that the way you get more serotonin or more norepinephrine is that your neurons are releasing them properly. But what's happening is those sending neurons are participating in reuptake. So these neurotransmitters, these little black dots here, are getting taken or sucked back into the sending neuron, which therefore means that your body is not, or your brain is not getting the right amount of serotonin or norepinephrine. So what the SSRIs do is they actually block the reuptake buttons. So you can only pass it on to the next neuron or the receiving neuron, which therefore can help elevate mood. The third is a mood stabilizer medications, and this is what we call, or lithium. It's actually a salt. And we find that it can be effective with bipolar and decreasing the risk of suicide. But again, it can have a lot of heavy side effects. We actually can see some of the same side effects as antipsychotic drugs with lithium. And the final options for psychological disorders are between brain stimulation and surgeries. So ETC is a type of brain stimulation. It's a shock therapy. We find this can be effective for people who are not responding to medications and people who suffer from severe depression. Magnetic stimulation is kind of interesting. This is where they actually implant a stimulator, or what we call, I'm sorry, team. I was talking about something different. Magnetic stimulation is when they actually connect magnets to the front of your brain. What they're trying to do here is activate the left frontal lobe, because they find that in the left frontal lobe can be underactive with people who suffer from depression. So they're trying to activate that part of the brain. What I was talking about before was what we call deep brain stimulation. And this is where you implant an electrode into the brain. And between specifically are focusing on the cortex of the brain. So the wrinkly part between your frontal lobe and the limbic system. And what they find is that this part of the brain is not always as active or functioning as well in people who suffer from severe depression. And so by putting an electrode there, you can stimulate it regularly, and they find that that is more effective. And then finally we have psychosurgery, and that's a lobotomy when we cut neurons in your frontal lobe. Right here I have a picture of Rosemary Kennedy. This was JFK's sister, older sister. She did receive a lobotomy where they did destroy a good portion of her frontal lobe, and it was said that she was never the same since then, and actually was probably lived life a little bit more like a vegetable after the surgery. And that is it for today.